welcome to my YouTube channel, and in this video I will tell you about CBT has received the greatest amount of imperial support of the psychological treatment of anxiety disorders. In our treatment algorithm CBT, psychological treatments of anxiety disorders in our treatment algorithm CBT stands with the SSRLs as first line treatment. Choice combining drug therapy and CBT have shown mixed results in the favoring an approach over the other, depending on the type of anxiety disorders. A review and meta-analysis approach the questions of combinations treatment over. Monotherapy of CBT is anxiety by hypertensing that CBT would be more stressful compared with medications. However, the medical held an advantage over CBT is depression. Within the anxiety disorders, there are great ways in the responsive to either CBT or medication, with CBT holding an advantage or medication in the patient with panic disorder. By construct patient and with social anxiety disorders with more responsive to medications. The choice of medications or CBT alone or in combination is based on several variables, including the availability of a therapist, the affordability of CBT, which costs more than medications, especially if drugs are prescribed in the primary care setting, and patient preference. It is generally acknowledged that the treatments of anxiety disorders it is suboptional because of a lack of CBT therapies. There is great need to distill the essence of good therapy and to bring it into the primary care settings with an emphasis on education and staff training. Oxford University Press has published many excellent manuals that includes both therapist and patient guides. The professionals on the intents-based self-administrative therapist call of the further research into the efficiency of the method of demonstration. Although many treatments are effective for anxiety, not all of them can help anyone, and not all of them are effective for all anxiety disorders. A simple phobia is easier to treat than a complicated case PTSD. The most empirical sports treatment are SSRI and CBT. Relapse and related from CBT compared with medications are under studies area, although our clinical experience suggested that CBT has a longer treatment effects if the patients continue to the skills. The helping relation is less emphasized in CBT as a creative factors, but it is considered important in building trust and support, serving as springboards for patients to consider the erroneous belief and behavior. The therapist is about capturing the patient disorder with regards to the generous evolution and maintenance of the disorder over the time. The therapist often incorporate manual or other fundamental and may propose daily homework to help the patient learn about adaptive ways to manage and reduce the alarm, change irrational and dysfunctional belief, and develop adapting coping mechanism. Often throughout exposure exercise to the most appropriate extent possible. Patients are taught the ABC model to help them understand the dynamic and reciprocal relation among feeling through the behavior. Patients' compliance with the therapy is directly proportional to the treatments of effectiveness. Emotional interviewing, which is used to help patients examine the cost benefits ratio of their throughout and behavior options.